Welcome back to You Heard It Here with Dr. Gary. I'm Gary, one of the clinical audiologists and part of the ownership team here with Advanced Hearing Group in Scottsdale, Arizona. This is earwax removal vlog number 46. In today's episode, we're going to be taking a look in a patient's ear who allows us to clean their ears every 3 months. I shouldn't say they allow us to clean it every 3 months. I should say that they request us to clean it every 3 months, because when we wait anytime 6 to 8 months or beyond, they end up with their ears being stuffed with wax, experiencing oral fullness and reduced hearing. So you could see from the beginning we had a view of the eardrum, but there was a lot of wax there, especially for just 3 months of buildup. We're going to use the curette to remove this wax, scrape it off the side of the ear canal wall so we prevent immediate buildup. We've asked a couple of times in videos for people to comment on different topics they'd like to learn about with our Did You Knows, because our goal is to, of course, entertain you with these earwax removals and to give some knowledge. So, per one of our comments, the question was about otitis externa and otitis media. So basically, ear infections of the outer and middle ear. Did you know that swimmer's ear, or otitis externa, can cause swelling of the ear canal, itching, and redness in the ear canal? It can also cause a pus-like discharge from the ear, oral fullness, and the feeling of muffled or reduced hearing. If you're experiencing any of these symptoms, please get in to see your primary care doctor or hearing healthcare provider and have them evaluate the health of your outer ear. If you like these wax removal videos and think we provide some interesting and valuable content, please take a moment to like, subscribe, and comment. It does really help with the YouTube algorithm, and it lets us know what information you want to learn about. Alright, now we're on the other side. We're going to use the curette to finish cleaning out this ear. We get a great view of the eardrum there. This has been You Heard It Here with Dr. Gary. Thank you for watching. We'll see you in the next video.